Pete Smith. I'm 70, I'll be 73 years old here in another 2 months. Love the outdoors, snowboarding, mountain biking in the summer, and fairly active. My wife and I have lived up there over 30 years. It's our only residence. A couple of injuries over the years. It's second surgery. I had a surgery in college way back in the prehistoric times. An injury from water skiing, high-speed skiing. I bit the dust going a little too fast. Dr. Goodwin performed the surgery on the right shoulder and rotator cuff. Had 2 severed tendons, 1 torn tendon, and a bicep tendon that was out of place. Dr. Goodwin, I made an appointment here. I was lucky enough to get in, I felt, because recommendations I had from 2 doctors locally here, 1 doctor out of state. Who would you go to if you needed this kind of treatment? And all 3 of them were very strong in their recommendation of Dr. Goodwin. So I came down here, I saw Dr. Goodwin. He looked at the MRI, put it on his laptop, went through very thoroughly with me as to how he viewed the damage that was in there on the MRI. The staff here, all of them, you know, there was a check-in, availability all the time by phone, no complications, a few questions, and when the questions came up, you know, sometimes you feel that your questions are pretty trivial when you don't have a problem, but you want to know if you're doing something right or can you do something. Very responsive. I would totally recommend Dr. Goodwin and the Shoulder Clinic of Idaho. Based on my experience, I don't think there's any other place anywhere I would go. If I could get here, this is the place I'd go. Pain-free. And I continue to do my exercises, as Tom said, that when you don't think that you, when you're not thinking that you had this surgery, he said, then the recovery is complete. And I still do the exercises required, and I think I'm in full recovery, and maybe I could quit those exercises, but the thing is strong, and I'm doing all the activities I want to do right now.